In the early 1960s, one woman stood between America and the worst pharmaceutical disaster in history. While 10,000 babies around the world were born with devastating deformities, the United States escaped almost entirely. This is the story of the miracle drug that became a nightmare, and the unlikely hero who refused to back down. Her name was Dr. Frances Kelsey, and she had been on the job for just 1 month when she made the decision that would save thousands of American lives. But it would cost her everything. This is the true story of thalidomide and the woman who said no to corporate greed. In 1957, a German pharmaceutical company called Chemie Grünenthal released a new drug called Thalidomide. They marketed it as the safest sleeping pill ever created. No overdose was possible. It was so safe they said pregnant women could take it. And pregnant women did, by the thousands. Doctors prescribed it for morning sickness. It worked perfectly. Women could finally sleep through the night without nausea. It seemed like a miracle. The drug became a massive success across Europe, Canada, Australia, and over 40 countries. Sales skyrocketed. Pharmaceutical companies around the world wanted to sell it. In the United States, a company called Richardson Merrill applied to the FDA for approval. They called it Kefauver. They promised it would be a blockbuster. They had already manufactured 2.5 million tablets just waiting for approval. They had doctors across America giving out samples, even though the drug wasn't approved yet. Over 2,000 American doctors were handing it out like candy. All they needed was one signature from the FDA, one approval, one rubber stamp. That's when Frances Kelsey walked into the room. Dr. Frances Kathleen Oldham Kelsey was not who you'd expect to change history. She was 46 years old. She just started at the FDA 1 month earlier. This was literally her first assignment. The drug company thought she'd be an easy target. A new employee wouldn't want to make waves. She'd just sign the papers and move on. They were very wrong. Kelsey looked at the application. Something felt off. The studies were sloppy. The data was incomplete. The company claimed the drug was so safe it couldn't possibly cause harm, but the evidence was weak. One study caught her attention. A British medical journal reported that thalidomide caused nerve damage in some patients, tingling in hands and feet, numbness, peripheral neuropathy. If the drug affected nerves in adults, what would it do to developing fetuses? Kelsey asked for more data. The drug company was furious. They called her stubborn, unreasonable, a bureaucrat with a power complex. They had executives call her boss. They had doctors write letters saying she was delaying a miracle cure. They had politicians pressure the FDA. Frances Kelsey didn't care. She wanted proof the drug was safe for pregnant women. The company couldn't provide it because the proof didn't exist. And then the reports started coming in from overseas. In November 1961, an Australian doctor named William McBride noticed something terrifying. He'd delivered 3 babies in 1 month with the same rare birth defect. Babies born without arms, just flippers where their limbs should be. He started investigating. All the mothers had taken thalidomide during pregnancy. In Germany, another doctor, Wittekind Lenz, was seeing the same thing. Dozens of babies, same deformities, all linked to thalidomide. The condition was called phocomelia, Greek for seal limbs. Babies were born with hands growing directly from their shoulders, feet from their hips. Some had no limbs at all. And it wasn't just limbs. Internal organs were damaged: hearts, kidneys, intestines, ears, eyes. Over 10,000 babies worldwide were affected. In Germany alone, over 5,000 children were born with severe deformities. Thousands more were stillborn or died shortly after birth. In Britain, over 2,000. In Canada, over 100. Japan, Australia, across Europe, everywhere the drug was sold, the same horror story. Parents were devastated. Doctors were shocked. Pharmaceutical companies tried to deny it, but the evidence was overwhelming. Thalidomide was a monster. In November 1961, Chemie Grunenthal finally pulled the drug from the market in Germany. Other countries followed. The nightmare was ending, except in the United States. While 10,000 babies around the world were born with catastrophic deformities, the United States had only 17 confirmed cases. 17 out of 10,000. Why? Because Frances Kelsey had refused to approve the drug. For over a year, she'd been blocking approval, demanding more data, ignoring pressure from the drug company, politicians, and even colleagues. Richardson Merrill had already manufactured millions of pills. They had 1,200 doctors across America distributing samples to over 20,000 patients, including pregnant women. But because the drug was never officially approved, it wasn't widely available. Most American women never took it. Most American babies were never exposed. Frances Kelsey had saved thousands of American children from a lifetime of disability. She had stood between corporate greed and a national tragedy. When the truth came out, America was shocked. The FDA was praised. Frances Kelsey became a national hero. In August 1962, President John F. Kennedy personally awarded her the President's Award for Distinguished Federal Civilian Service. She was only the second woman ever to receive it. The media called her the woman who saved America. But her fight wasn't over. The thalidomide disaster changed everything. Congress was outraged. The public demanded reform. In October 1962, President Kennedy signed the Kefauver-Harris Amendment into law. It completely transformed drug regulation in America. For the first time, drug companies had to prove their products were safe before selling them. They couldn't just claim safety. They had to provide evidence. They had to test drugs on pregnant animals. They had to report side effects. They had to prove efficacy, not just safety. The FDA gained the power to regulate drug advertising, to inspect manufacturing facilities, to pull dangerous drugs from the market immediately. This law is why your medications today are safer than ever, why drug trials are rigorous, why pharmaceutical companies can't just make wild claims. All because one woman refused to be pressured. One woman asked for proof. One woman said no. Frances Kelsey worked at the FDA for another 45 years. She retired in 2005 at age 90. She died in 2015 at 101. Today, thalidomide is actually used again under strict regulations to treat certain cancers and leprosy, but it's never prescribed to pregnant women, ever. The victims of the thalidomide disaster are still alive today. Many are in their 60s now, living full lives despite their disabilities. Their courage and resilience are inspiring. And it all could have been so much worse for America. But it wasn't, because one woman stood up. The children who were born because of her decision, they never knew her name. They never knew they owed their lives to a bureaucrat who simply did her job correctly. But we know. History remembers. And the next time you take a medication that's been properly tested, properly approved, properly regulated, thank Frances Kelsey. One woman, one decision, thousands of lives saved. If this story inspired you, hit that subscribe button. I cover forgotten heroes and hidden history that changed the world. Leave a comment telling me, had you heard of Frances Kelsey before today?